The caregiver experience is one that's deeply personal and unique. Understanding how to support caregivers means hearing their stories and better understanding their needs and challenges so that collaboratively developed programs at the community level can support them. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association, and a podcast that you've rewarded with 100,000 listens in 2022. Thanks for your support. I'm Tom Hedderly with AHA Communications. Nancy Myers, Vice President of Leadership System Innovation at the AHA, leads this second episode of a four-part series of discussions on hospital and community partnerships that support family caregivers. In this episode, Nancy hears the personal story of caregiver Dale Harmon of Ventura, California, and talks to Janice Aharonizar, Clinical Program Manager at Ventura's Community Memorial Health System, to understand how its Caregiver Navigator program collaboratively supports Dale and others.
Janice, so great to be with you again today. And Dale, thank you for coming in and participating in today's discussion. Really talking about your experiences as a caregiver will help our healthcare field better understand the needs of people serving in these roles and help them to provide vital support. So Dale, tell me a little bit about yourself and the person that you're caring for.
I'm Dale Harmon. I want to say that my wife, Gloria, is the recipient of my caregiving. I like to give titles, and I found that title, and I think it's a good one. Gloria and I met in 1963. And we each went our separate ways. We dated a few times, and later on in 2009, we reconnected on Facebook, dated, and we married in 2010. And so we've been married now for 12 years. And in about 2015, she was diagnosed with mild cognitive impairment. And even though I've had experience in the healthcare industry, I really didn't understand what that was leading to. I found out that as the next couple of years went by, that the memory issues were simply increasing. There was more and more difficulty for her to recall simple things. One Thanksgiving, we were cooking a meal for a big family gathering, 22 people or something like that. And she was always by my side helping out. And that weekend, she just collapsed, not physically, but her mental ability to do anything. She couldn't make her famous apple pie. She couldn't do just a whole lot of things. And that just brought me to a point where we had to do something. And so I looked around for a neurologist, and at first her daughters were not in favor of going to a neurologist. But within about a year of the first appointment, we were forced into another appointment. We had an incident where she fell out of bed, 10 o'clock at night. And so I had to take her to the hospital. And it was right during the whole COVID pandemic. And I think that's where I earned COVID. But in late December, we had a diagnosis. The attending physician at Community Memorial Hospital got her in touch with the neurologist by way of an iPad. And so he interviewed her and then scheduled an appointment for February 28th. I can remember these days because they're just so fresh to me. And I hadn't looked at it this way, but the neurologist asked her to draw a clock and show 11 o'clock, and she couldn't do that. So the neurologist said that he was going to put me in contact with a caregiver navigator. And that's how I met Janice. And Janice had experience as a caregiver herself. so I could relate to her. And we formed a real good working connection where she could ask me questions about what was going on in my life and how I was sleeping, for instance. And I was not sleeping well. And through that whole process, she put me in touch with this Savvy Caregiver workshop, and they have a workbook. And I got into that workbook, and I highly recommend that workbook for anyone who is going through the caregiving process. If you need to give care to a recipient, this book answers an awful lot of questions right out of the get-go. And what I learned through that process was that my needs are important as her needs. And in that initial class, they asked about putting on your own face mask first. When you take an airplane ride, that's what you're instructed to do, is put your own face mask on so that you can take care of your recipient. It took a little bit of time for me to really bring that concept into my life. We know we're supposed to, but prior to this, there were just times when she couldn't do the things that I was asking her to do. And I'm a general contractor. I'm the boss, and I kind of look for people to do the things that I ask of them. And she had reached a point where she just couldn't. The Thanksgiving meal thing, that was kind of an evidence of what was going on there. But some of the things that I learned out of this Savvy Caregiver workshop is to look for depression, look for anxiety, and be aware of the frustration that your recipient is going through, and try to avoid pressure. I just jotted those things down as a reminder because she did go through times of anxiety. She had no desire to go talk to the neurologist whatsoever, but her daughter went with me and calmed things down. And so these are kind of focal points for me as the caregiver to approach daily. And it's an ongoing lesson. Recently, a couple days ago, had Halloween, and I sat in the other room while she handed out the candy. And all of a sudden, she was back in her second grade classroom. It was really fun to hear and listen to, because she was engaging with the children coming up really like a person without any dementia problems, no Alzheimer's. It just wasn't coming through. And I went in toward the end of the evening to find out if she had run out of candy, and she was upset with me. She was doing fine, and she said, "Well, you do it." And I had to back off, and I had to explain. I just was I was afraid that we were going to run out of candy. Well, it calmed her down, but it's a simple reminder that every single interaction that you have with your recipient, especially with Alzheimer's, can lead to a little confusion, anxiety, and those are the things that you absolutely need to avoid. So I've looked for things to engage her, and in fact, we talked a little bit about it this morning. She has real good connections in the morning, not so much in the afternoon, in the evening. But I said, we did the quilting exercise, and I said, but you didn't participate very much. She says, yeah, but I'm not finished with that. I want to do that some more. And I said, oh, okay. Another book that I got a hold of was from the Mayo Clinic. They have a book on dementia and Alzheimer's. And in the introduction, in the preface, they talked about someone who had early onset or young onset Alzheimer's. And that gentleman started doing watercolors. And I said, wow, that's a good idea. So I went on Amazon, I bought some watercolors, some paintbrushes, and some books. And just yesterday, she completed a real intricate Christmas camel, and she was so proud of it. And those are the kind of activities that help her avoid the depression, that help her relieve the anxiety. And those are things, to me, that it really means to be a caregiver. I have my own needs, but so does she, and we're married. And every one of these situations are different. In the Savvy Caregiver workshop, we had people who had their loved ones already in a facility, and they had just developed maybe faster than we are developing. But there's every condition that you can imagine. People who have that I've encountered at the brake store, waiting to get my brakes fixed. One lady said, "Yeah, I've gone through it with my stepfather," or another person said they went through it with their brother, and there's just every dimension that you can imagine.
Thanks for sharing. And it sounds like Gloria is in great hands, and you're bringing her just wonderful moments of joy in her life. I'd start with the question to reflect on yourself and what's rewarding to you about being able to be Gloria's caregiver at this point in her life and in your life?
I don't want to get to the end of this. I'm 78, she's 77. We're not on the uphill journey. And I want to be able to say, I've done my best. I think it's an important thing for anybody to have done their very, very best for their wife, whether they have dementia or not. It means a great deal to me just to be in the moment and acknowledge and realize all the things that she's going through, and try to get ahead of them. Funny thing is, it isn't like that. She has a wonderful sense of humor. Usually Wednesday or Thursday, her daughters will come over for a little, maybe they'll take her out to dinner or spend a little bit of time. And about 2 weeks ago, I baked some bread, and they came in, and I had some raspberry balsamic along with a little bit of olive oil. And the girls started enjoying and Gloria said, "Well, you're lucky. All he gives me are pills."
Yeah.
Those moments most often happen in the morning. We laugh and talk. We have a routine we try to go through every single morning. I find that the routines that we can establish and maintain help her. They keep her more balanced. They keep her out of frustration, and those things are really, really important.
So I can imagine that for folks like yourself who are caregivers to those that they love, that while there's great joy in spending time with her and taking care of her and making sure that there will be no regrets on your part in her care. On the other hand, I can imagine that it must feel very isolating for you at times. I wonder if you could talk about that. Sometimes have a sense of isolation
Oh
in
yeah,
your role.
absolutely. I have a deer hunt coming up that I'm trying to get my body in shape for, and I joined a club. I work out, but this past 2 weeks I've only been able to work out twice, and that's frustrating. But we've hired somebody to come in and help out from time to time, and she's been sick, so I couldn't go do the workout that I would normally like to do. And when that happens, who do you reach out to? Um, I'm not that close in the neighborhood to any of the neighbors. I did have a lunch a couple of weeks ago with the pastor of our church, and kind of described some of the things that we were going through. His wife is also having some physical health problems, and he said, well, it's not what either of us signed up for, and it isn't, but we have to keep moving forward. So that is absolutely the case. We do feel isolated. And so this Wednesday or Thursday that her daughters come by for a visit, I try to take time to sit down in the living room and talk about all the things that we did during the week so that they have the ability to understand that mom's doing okay. And so the four of us will just sit there and visit. And that's a real valuable time to me because it does allow me to offload a little bit.
And to put your own oxygen mask on first.
Yeah. Yeah.
Yeah. You know, caregivers are often find themselves having to to physically do things that they never would have thought of doing for another person before. And I'm wondering, as you think about the day-to-day tasks of caring for Gloria, what have you found were the easiest for you to just pick up and do? And what are the hardest? What would you want your physicians or other healthcare providers to understand about what doesn't come so naturally and what does come naturally for caregivers?
When I first found out that I had actually gotten a promotion to caregiver, I decided to accept it for what it was. And I think that's just a choice that you have to make. I want to read something to you that I picked up from one of the books that they were talking about very specifically that there is no cure, that science still hasn't found a way to prevent or bring somebody back from Alzheimer's or dementia. And so in that light, I wrote this down. Therefore, there's only one option for the caregiver: acceptance. And in human psychology, acceptance is a person's assent to the reality of a situation, recognizing a process or condition without attempting to change or to protest it. And I'm a builder, and that doesn't that definition doesn't define me, but it's a necessary thing to accept the reality of what you're dealing with so that you can do your best job to move through. I don't know if that answered exactly the way you were looking for, but that's what I found.
Oh, you answered it exactly the way that you should. Really appreciate you taking the time today to share with us your experience and all of the support that you're giving to your Gloria. And wonder if we could turn to Janice now and talk a little bit about the program that you've been involved in, the Caregiver Navigator program. Janice, as you've been listening in to Dale's story and have been working with him and Gloria over the last few years, how is the Caregiver Navigator program designed to help folks like Dale and his family?
Well, I think part of that is integrating it into our system, and that's like an ongoing thing because our community memorial hospital is a hospital in Ventura, it's a hospital in Ojai, it's an aftercare in Ojai, and it's 22 clinics. But so that's a lot of folks and a lot of providers. But part of it is the integration, because if you go back and listen to what Dale said, he was referred to Caregiver Navigator by the doctor. And so, putting this idea of caregiving in front of everybody and who's a caregiver and that it could be anybody with any type of issue is important, even to our providers. And it was to me. As I said before, I didn't tell my story in the first case, but I will tell it eventually. I was a caregiver and I had no idea. So everybody recognizing it, and then those internal referrals, because when it comes from your doctor, knowing that there's issues and understanding what they are, it gives it a lot of merit. And we share, because it's in our internal system, an electronic health record. It gets to me right away. I follow up right away. And I just present the program for what it is and ask people if they're interested. And 99.8% of the time, people are interested in it. It's very fluid. It very much fits the people, the players that are in it, their relationships. So some of the caregivers, I always let them know that, yeah, I'm going to help you with resources and different things like that. It's figuring out and assessing where kind of the pain points are. And then I leave it up to the caregiver how often they would like to be in touch with me. Our program is typically a 90-day program, 3 months. But if someone needs support longer, and many times they do, we just continue working together. And that looks like telephonic contact. And then I call them and we have conversations. We check in the role. I'm a licensed marriage and family therapist. In this role, I'm not giving ongoing therapy per se, but I do a lot of emotional support and a lot of assessment of issues and a lot of counseling. And so it really is effective because it's very fluid and very much based on the needs in that situation. And I think it's an easy connect for people.
Dale, you look like you might want to jump in and add something about the program. How did it work for you? And what do you think was the biggest benefit that you have received being part of the Navigator program?
For any other hospitals looking for somebody to put in Janice's position, duplicate her. You won't go wrong. She's been a huge help. I recognized right away because she mentioned the caregiving that she had done. And when you're going through it at the moment and you have somebody telling you that they've been through it, it's something that you want to listen to and appreciate, because whatever advice you're going to get, you know is coming from the heart. And that's very much what she did for me and for us.
So, Janice, caregiver support is very much a team sport. And loved how you talked about how you've integrated among your clinical staff the availability of the program. Really appreciated, Dale, that you talked about that you got to the program because of your neurologist telling you about it. Janice, can you talk about your community partners and how they are a part of the program and how they helped to develop the program with you?
Yes, because they really are an important part of all this. And I think, we at CMH have a huge interest in training and expanding this program across the US. So as part of that, I would say to people that you have the same pot of gold we do. There are many, many nonprofits in our area that provide things absolutely free of charge that are really helpful to caregivers. And so part of working with the caregiver is finding out what it is that makes it harder. And it's different for everybody. It is the isolation, absolutely. But for some people, they have a really hard time grocery shopping. For other people, they love grocery shopping because it's the only time they can get out and get away. So we have nonprofits that have volunteers that will shop. This particular program is for seniors. And they will get the grocery list. They'll drop groceries on the door. You pay them for the groceries. That's it. They'll get you exactly what you want. We have, for the benefit of Lyft throughout COVID, they provided completely free, within a 30-mile radius, transportation to any medical-oriented program, appointment that someone's going to. We have Tri-Counties Regional Center, which is for people with developmental disabilities, that provide all kinds of services. So it kind of goes back to finding out who is serving caregivers and patients and really getting an inventory of who they are, how to refer them. The program that Dale was talking about, the Savvy Caregiver Education Program and the booklet, that's through Alzheimer's Association, who they're terrific and they're nationwide. That is completely free. And one of the things they provide is information for those taking care of dementia and how in the heck you deal with some difficult behaviors, because people do have sundowners. They don't necessarily like to take showers. They don't like to be told what to do. These are not easy things to deal with, but those are all things that are free. And there's many, many other examples. And so they help us because we can't do it all. We're working within our scope of expertise, but there's lots of other people in the community that provide things many times free.
I wanted to ask you, you and your team with your community partners participated last year in the American Hospital Association's Hospital Community Collaborative program. How did that help your team and help with the development or the dissemination of the Caregiver Navigator program?
Well, it originally started with kind of a coalition of home health and skilled nursing facilities that a prior person that was in our department put together, so that these home health and skilled nursing facilities were kind of vetted to be part of who the hospital and the clinics refer to, because we know they're good with communication, follow-up, patient care. And from there, it was expanded to include anybody that is a hospital in the area and anybody that is dealing with caregivers. So through those kind of contacts, it enhances our services, it enhances what we can provide.
Hmm.
It really ups the game with the need for communication, because, it's a great thing that so many things are going on, but when everybody doesn't know about it, it's not. So it's just really helped move the needle as far as the different types of patients and caregivers we can help with. We've struck up a lot of, very professional relationships with people. So I'm not just referring somebody to, Dale, to, hey, would you like to know more about the Savvy program? This might help you. I can say to him, this person, Sergio, is going to call you. This is how he's going to communicate with you. Expect the call. So it really decreases a lot of the barriers to fatigued caregivers getting the care they need. And one of the things that a lot of caregivers struggle with are these large systems that almost always are part of caregiving package.
Hmm.
Social Security, Medicare, Medi-Cal, the hospitals, Tri-Counties Regional Center, just these big, Veterans Administration, that are big bureaucracies that, don't necessarily call you back. You have to fill out a lot of paperwork. People don't have the energy for that. And so if I know those partners better and I can speak with them directly and know that I'm handing people off to somebody who's much more communicative and responsive, that's a great thing. That's a great thing.
Thanks. And I think in closing, Janice, end with you reflecting on what Dale has shared about his and Gloria's journey today and what you've seen in your work with other caregivers that you and your team are supporting. What's one piece of advice that you'd offer to other hospitals or health systems that are interested in better supporting caregivers in their communities?
Well, I would say that they're welcome to contact us, because both Maureen and I are in this in a heart way, because we both have had and been caregivers, and we're happy to share our information. In May, we'll be going to Minneapolis to a conference where we're going to be presenting our program and how to build a sustainable, ongoing Caregiver Navigator program. So we can be a point of contact for them. But the other thing is, I think, to go on the Rosalind Carter Caregiving Institute website and look at it. It's very interesting. It's got a lot of great information, and really familiarize yourself with what the whole situation entails, and then move forward and talk to the administrators in your system and see what you would need to do in order to start building a program like that. Typically, hospitals and clinics, they want to see the bottom line, and I don't blame them, because they need to stay in business. So they're going to want to know, if there's a way to decrease hospital and ER readmissions, they're going to be all over that. And so a hospital that's looking into doing this needs to know what the C-suite, what the administrators need to see to fund this program. And then they need to ask those same people to consider looking at the qualitative evidence of how important it is. What does this help decrease depression and anxiety and the sense of burden to caregivers? Does it help increase the resiliency and the confidence of caregivers? And some of those things can be measured fairly well, some of them can't. But that's why having Dale and other caregivers involved in something like this is so important, because maybe we can't exactly measure it, but on a human level, we can hear it and understand how really important it is to our community and to our society.
Yeah, and I reckon back to our first podcast, talked about that 1 out of 5 of us in the United States are a caregiver today, which means that all of us have likely been a caregiver at some point, are a caregiver today, or will be in the future. And we certainly all know someone who is. So I think that personal connection too is really important to make to leadership. This is an experience that I think most of us have at least had some experience with.
And I was just going to say, if you go on the Rosalind Carter website, her caregiving, one of the first blurbs on there is that in time, we will find that all of us will be a caregiver or a care receiver in our lifetime. So that means that it's everybody.
Well, thanks. And I think that we'll end it there. And I want to say, Dale, thank you again for sharing your time with us today and sharing your story and Gloria's story. It's really, I think, helpful for us to stay grounded in the lives of those that we seek to serve. And it's exciting, Janice, to hear more about your Care Navigator in action and how it's making a difference in the lives of folks like Dale and Gloria. In our next episode, we'll talk more about the care recipients themselves, those folks that caregivers are caring for, and the different types of chronic medical conditions, both mental and physical, that they're helping to manage. Thanks, everyone, for your time today, and we'll be in touch soon.